For everybody at home watching, I'm Dr. Moyo. I'm here and joined by my lovely wife. She is a clinical psychologist. And right now, a lot of healthcare workers are dealing with some serious mental health issues. And as a health worker myself, as a physician, this past week and a half, I've realized that there's been some anxiety, some anger, some insecurity that I've been dealing with personally as I approach my job. And I wrote a blog about it. I've actually written 2 about it so far. And I've gotten some actually really encouraging feedback. When I say encouraging, I really mean people who have frankly walking the same path that I am. It's always nice to know that by sharing your inner emotions, others are able to connect and resonate with that. We were talking yesterday and we thought it would be important, given that she's a mental health specialist, for me to have a little at-home therapy. Now, I should mention this isn't a real therapy session, but we're doing it to highlight a few things. One, the mental health stressors that healthcare workers are undergoing, but also 2, and importantly for me, the importance of Black men to express their emotions and not keep things bottled in, and really just be able to talk in an open space. So I'm here with Dr. Pamela Moyo. Thank you for joining me.
Thank you for having me.
Thank you for having me. So I'll let you lead.
Well, what do you want to start off first?
I think I want to start with the emotions that I mentioned.
So anxiety, anger, insecurity.
Yeah, and there's a 4th, which is I call it self-recrimination, but really kind of blaming myself for some things. Not blaming myself. That's what I'm looking for. Just kind of pointing the finger. And it's not blame. Blame's not the word I'm looking for. It's saying that, taking a look at some actions that I was taking or not taking. Mm-hmm. And saying, hey, this isn't who you usually are, and trying to figure out, the why behind that.
So what do you kind of, with the whole situation, what kind of comes in first in terms of emotions?
I think the thing that, when you say first, you mean most important?
Not necessarily. So obviously the situation has a lot of emotions that are tied to.
Yeah.
But what's the first that you experience, like when you walk into work or when you think about this situation or COVID?
The word excited comes to mind, but it's not the right word. I was geared up when I first realized when COVID sort of came to San Diego. We got flies in this house. And I was geared up in the sense that we're trained for this, right? I'm a physician. We're trained to help people in their time of need. And if there was going to be a time where my job felt more important than ever, it's going to be now. Mm-hmm. So the first emotion that I felt was, okay, we're ready for this. Mm-hmm. And then...
When you say we, who's we?
Healthcare. Right, my fellow physicians, the nurses, we're really well trained to take care of situations just like this when we have all of the tools in the tool belt. Mm-hmm. And the system works really well when the physicians and nurses, first responders have all of those tools, and the communication's great amongst us, and then from multiple levels around us. So, above. County health, et cetera, et cetera. When all those pieces come together, it's a really encouraging thing, and it's a thing a lot of people don't get to see, and it's great to know that's there. So that was that aspect, I guess, of how I approached it. But then, then sort of the layers of the onion started to be peeled back about how little we know about right now, what we're dealing with. It's a coronavirus. We're used to dealing with coronaviruses. I think society, physicians, many people just thought, it's another coronavirus, right? You often hear people say it's just like another flu, but it's not. There are a lot of things that we're seeing that say that it's not, and I think the world's playing catch up. Mm-hmm.
Is the fact that it's not like the flu kind of worrisome, or that hospitals might not necessarily be prepared for?
Yeah, I think for me personally, the worries that I've had and the fact that it's not like the flu is understanding whether, frankly, understanding whether we have the right protective equipment is a big thing. I mean, I think it's 9% of the people infected in Italy are healthcare workers. Something like over 3,000 in China were healthcare workers. And when it comes to things like the flu, even TB, I routinely take care of patients with tuberculosis, and I never think twice about entering their room. They're in the right room, airborne precautions, I have my N95 on, whatever else that I need, and I never think twice about it. And now, given my situation, there's a hesitance because I don't know if I have the right protection.
So that kind of holds you back from diving in and being excited about taking care of patients.
It's another layer that I have to deal with, and I think healthcare workers are having to deal with right now, is one, just a lack of the protective equipment being there. There's a run and shortage on masks, on gloves, on Purell, hand sanitizer, a whole bunch of things. And we're gearing up for a long fight with this. It's not 2 weeks, it's not going to be a month, it's going to be throughout the rest of spring, and my fears and concerns into the fall when flu season comes back around. So, supply chains are gearing up. Supply chains are, you have Intel and Ford and other big companies. And frankly, what I'm really at least buoyed by are some of my friends who are putting together protective equipment for doctors and nurses. So I think that protective equipment will be there, but the question also is not necessarily just the amount, but is it the right protective equipment? There's been a petition on change.org, really, that in one picture sums it up. You see the PPE or personal protective equipment in China, you see what they're using in Italy, and then you see what's commonplace in the US. And it doesn't pass the eye test. And then on the other hand is the concern that it's not going to pass the real test, which is actually protecting health professionals.
So that's what makes you hesitant.
In part, it's definitely one part of the one piece of the puzzle.
What's the other part?
I mean, the other part is life. Life has blessed me with the chance to be a father, and
congratulations.
Thank you. Yeah, I mean, to be honest, I'm frightened about the idea of bringing home something that could harm my wife and my child. And I have to try to be really smart and really aware with how I move, and what I do when I'm out outside of these four walls, and then specifically when I'm in the hospital. So I think that has definitely been the biggest factor. In me deciding how to see patients that are COVID, PUI, or COVID positive, how I approach their care. And I've never had that before. I've never had the pump the brake thought. And not to say, any of us, myself included, go into a patient's room flippantly or without trying to protect ourselves or those people around us. Somebody comes in with the common cold, we put them on what's called droplet precautions. Somebody comes in with the flu, we put them on droplet precautions or contact precautions. And we're doing the same thing with this coronavirus, and we think it's going to be enough, but the problem is we don't have the evidence to say it's going to be enough. And we have two things. We sort of have 2 opposite points. You have anecdote and you have science, right? Anecdote being the stories that you hear, science being the observed or randomized controlled trials, whatever it might be, that comes out after time, that proves anecdote false or proves anecdote true. And I think the thing that we don't have enough of with this novel virus, and to nobody's fault, is the science. So we're really emotionally responding to anecdote. We're also, from a practical, functional, medical standpoint, responding to anecdote.
And how do you respond to those anecdotes?
I'm trained to have an analytical mind when it comes to things like that. To cut through the emotion and get to some sort of rationale. Meaning that you know, you can hear an anecdote about, and I'm sure there's 100, if not 1,000 now, stories about it, but healthcare providers who are on the front lines who get sick taking care of these patients, and they were wearing the right masks, wearing the right equipment, they still got sick. And that anecdote is, well, that means that there's something broken in the system. Now there could be a plethora of reasons why that person got sick, but you cut through that and say, okay, well, what do we know? We know it's a respiratory virus, so we put on masks. But are they the right masks? You know, what's the science behind that? And then there's the emotional part of the anecdote, or what the anecdote triggers, the story triggers, that, you know, I think it overcomes things sometimes. Sometimes it does overcome good science. But I think that's the problem, is we don't have good science.
So not much is known?
Not enough. Not enough, I think.